So we are going to continue this interview. And my first question, even though he has been answered part of this, but I want he explained to us what is the estrogen, the progesterone, and the testosterone.
Okay, estrogen is basically produced by the ovaries in a woman. It is the more feminine of the three hormones. It's involved in the egg. In other words, it's involved in fertility, but it's also involved in a lot of other things other than creation. It's involved in your skin. It's involved with your skin, your brain, your bones, almost everything. Mm-hmm. The progesterone, which is produced by the corpus luteum, which is what happens in the ovary when the egg is dropped and goes down the fallopian tubes. That's progesterone's main function, was to maintain the endometrium and maintain a pregnancy. But the other things that it does, it helps with hot flashes. It helps with mood, definitely. The active metabolite of it hits the GABA receptors in the brain and helps with sleep, helps with anxiety, those sorts of things. It also deals with weight, the balance of estradiol and testosterone, control water weight gain. As far as the testosterone is concerned, it is the quote male hormone, but at the same time, your levels are much less than a man's in a woman. But basically, it works with estradiol for vaginal wall tone and lubrication. It works for building strong bones and forming a nice matrix, because if you have your estradiol is okay, but your testosterone's low, your bones will form in like layers, sort of like the San Andreas Fault, where it can crack. Whereas if the two are in balance, then it's a nice lattice work that gets filled, and this bone is very strong.
Okay, so they all have to be combined more or less to be in balance.
They have to be in balance for you to feel at your peak.
100%.
Correct.
Okay. And you also answered a little bit this one too, about what is the ingredients of the bioidentical hormones.
Right. Well, the ingredients are the raw ingredients, or the active pharmaceutical ingredient, are the estradiol, the progesterone, the bioidentical hormones themselves, which again are derived from wild Mexican yam plants or soy. In my practice, we only use wild Mexican yam because there are some people that are allergic to soy, and we don't want any issues, so I don't have to keep two different types of progesterone laying around. Everything's wild yam, and it's synthesized in a lab to be the exact same ingredient, and basically we get a certificate of authenticity from the people who supply us with the chemicals, so that we know exactly, one, where it came from. In Florida, it requires a pedigree, so we know where it originally came from, and two, is it as strong as it's supposed to be? Is it between 95 and 105% pure? So as far as the other ingredients, they vary based on the compounding pharmacy that you use. So make sure that you ask what's in your cream base, what are your capsule fillers, those sorts of things. Your troches for sublingual, are they gelatin, or are they polyethylene glycol, or you can actually make a troche out of Hershey bars. So I don't know about that, but
it's good though.
Tastes good. Tastes good.
That's very good. Yeah. Well, now, why do women need hormones before, during, and after menopause?
Okay. Well, definitely you got to have hormones. Period.
Yeah.
As far as needing exogenous hormones, or hormones that come from me, before shouldn't be that much. Granted, there's some women who they're having trouble having children, so there's infertility doctors, and then they need to have progesterone, and they need to have HCG. So there are certain hormones that they'll need before menopause, but more normally it's going to be for fertility. I mean, granted, you do have PCOS, or polycystic ovary syndrome. Some of the girls will need progesterone. All right. Rarely do you see estradiol being needed premenopause. Perimenopause is generally the land of progesterone.
Yeah.
We try to do as much with progesterone in perimenopause as possible, because we can regulate PMS. We can regulate their mood, that sort of thing, and you know, sometimes in perimenopause, the testosterone level will go off. So, I mean, granted, sometimes we'll have someone who's on progesterone and testosterone.
The people who suffer a lot of headaches, they say when they have the period, they have a lot of headaches, or before. So this one is...
Again, first we try the progesterone, but yes, there are a lot of estrogen-related headaches.
Yeah.
So they can...
Excess or deficiency?
Deficiency. So therefore, when you give them, I have some doctors who do sublingual drops, and when a woman feels that she's getting a headache, she just does some estrogen drops. So, so yes, I mean, that particular side, that particular problem is actually helped with estrogen.
Okay, how long until I see the results using the bioidentical hormones?
Results are in the way you feel. In the way you feel,
Yeah.
4 to 6 weeks.
Okay.
You know, you can see results in a week to 10 days, but it's not going to be the full effect. The full effect of what you're taking is 4 to 6 weeks. If after 6 weeks you still don't feel good, you got to change things up. Things have to be adjusted.
Okay.
So that's why we do the levels. We do the levels at 6 to 8 weeks. So we see, are you absorbing the cream? You know, did we give you enough progesterone in that capsule? Did we overshoot you with testosterone? You know, you're anxious, you're agitated, you're arguing with your husband all the time. We might have overshot your testosterone. So 4 to 6 weeks, as far as skin and that sort of thing, those things take longer. I mean, you know, even when you go to a dermatologist and you apply something, it takes 6 to 9 months for that sort of thing to help. So, you know, you got to give that time. But as far as the feelings and the hot flashes and the night sweats and the moodiness and all that, and the lack of sex drive, those sorts of things should be gone, or close to being gone, in 6 to 8 weeks. Or 4 to 6 weeks, excuse me.
Yeah. Okay, so it's not too long. You have to wait before that. Are the